Welcome. I'm Taryn Offenbacher, Senior Communications Specialist on the Social and Digital Innovation team at Mayo Clinic and editor of Network blog. Today, Dan Hinman will be presenting how to start, grow, and manage a successful Facebook support group. Dan will present for about 35 minutes, and then we will open up to your questions. Your questions are always an important part of these webinars, so make sure you ask them in the comment box to the right of the video anytime throughout the presentation. Before we start, I'd like to let you know about a few upcoming events. Join us on August 14th for the webinar, How to Turn Authentic Stories into Social Media Sensations, presented by Jen Rittenhouse, Social Media Manager at MultiCare Health System in Tacoma, Washington. And then on September 20th, we have the webinar, Amplifying Your Voice, Podcasting and Media, which will be presented by Lauren Sudkamp, the social media strategist for UC Davis, and Dr. Sarah Medeiros, an assistant professor of emergency medicine and one of the hosts of EM Pulse. And of course, the do not miss event of the year, our Mayo Clinic Social Media Network Annual Conference, November 14th and 15th in Jacksonville, Florida. The conference takes place at the gorgeous Omni in downtown Jacksonville. This year, we expanded the program, and the lineup includes 4 dynamic keynote presenters, 2 networking receptions, and 6 breakout sessions with 3 workshops or presentations each, so you can fully customize your conference experience by choosing the learning track that best fits your needs. Do not miss it, November 14th and 15th. You can learn more about the program, the speakers, and all the conference details on our website. And now I'd like to introduce Dan Hinman. Dan is the Community Director for the Social Media Network, and he also coordinates our annual conference. He manages Hive Strategies, a firm devoted to providing expert advice about Facebook support groups. I'll let Dan tell you a little more about himself during the presentation. So turning the mic over to you, Dan.
Thank you for that introduction, Taryn. I really appreciate that, and I'm thrilled today to be involved in this webinar with my friends in the Mayo Clinic Social Media Network. I'm excited to talk about how to start and grow a successful Facebook patient support group. And I want to start by just telling you a little bit about my journey. I grew up in Utah, studied journalism at the University of Utah. I always thought I would be a reporter for some metropolitan newspaper, but shortly after finishing college, I got involved in public relations and then advertising and marketing. So I've spent my whole career doing those things. And in 1990, almost 30 years ago, I moved from Utah to the beautiful heart of the Willamette Valley in McMinnville, Oregon. And there I established my first agency, the Hinman Agency, and that focused on doing marketing and advertising for a number of clients, especially in the healthcare arena. And during that time, one of my clients was a hospital, Willamette Valley Medical Center, that I represented as an agency for 23 years. And part of that time, I was director of marketing. So those of you who were on small teams or working in a small environment, I was a part-time director of marketing with no staff at all, just freelancers helping me out. And so I get what it's like to try to run marketing and social and digital and traditional with a small team. About 7 years ago, I started thinking about the opportunity to help healthcare organizations with social media. So I started a second agency, Hive Strategies. And about that same time, I also joined the Social Media Network in 2011. I was an early adopter, a member of the Social Media Network. And about 4 years ago, after some involvement in the community, Liacy asked me if I would manage the Social Media Network. So that's how I got to this involvement. So I do the Mayo stuff 3 or 4 hours a day, and then I do my Hive Strategy stuff another 3 or 4 or 5 or maybe 6 hours a day, and try to juggle both those responsibilities. Next slide. So I'd like to tell you about kind of what got me to where I am today, and it has to do with my wife, Sandy. About 7 years ago, about the same time I was getting involved with social media, Sandy went for her annual health checkup. She got a call from the doctor's office about a week later, and when she got off the phone, I could see the fear and the worry and the concern in her eyes. I wondered what she'd learned in this phone call. And she told me with a lot of distress, I've been diagnosed with diabetes. Now, to me, that seems like a minor disease compared to all the other horrible things that could happen to people illness-wise in life. But to my wife, this was really deadly serious. Her dad had died of a heart attack at 72. He was a diabetic. She had 4 cousins who were diabetics, all of which had had limbs amputated, one who died. And this was extremely upsetting, distressing news for her. So I said, well, what did the doctor tell you? She said, well, really nothing. She's going to prescribe some meds. I've got an appointment with somebody in a month. I said, you're going to have to wait for a month to find out more about this disease? And she said, yeah. I said, well, are there other options? She said, well, they said there's a class I could sign up for. Costs $1,000, not covered by insurance, but I can learn about diabetes with this course. And so the more she told me, the more frustrated and angry actually I was getting with my hospital and with the doctor's office for not providing more patient support through a difficult time. And so that started this journey. My wife started this journey on trying to figure out how to manage her diabetes in a way that she could live with and feel good about. I started this journey of saying, how do we help patients who are going through difficult times as a result of the illnesses we're treating? I've been helping hospitals build their reputation and their patient flow and their revenues over all these years. And I said, but I think we're missing this piece where we can really help patients in a way that makes a difference in their emotional well-being. So that's how I got involved with patient communities. And next slide, please. And so I've learned over these last years, there's a right way and a wrong way to start, manage, and grow a community. So today I'm going to share with you the right way to do that so that you can have success and help patients as well. Next slide. So why an online support group? Talk about that briefly. There are many reasons why, of course, but one of them is becoming that it's harder and harder for patients to do in real life support groups. I mean, if you're an urban hospital and it's tough to drive into town and find parking and fight traffic, maybe patients live an hour or 2 away, and so driving in isn't realistic. Maybe your groups are at night when they're not working, and yet it's cold and dark in the wintertime. Maybe people are caregivers, so you've created a caregiver group, and they're not free to leave their homes to meet up with other people easily because of the seriousness of the care they're providing. All these things have made it difficult to continue in real life or in-person support groups. So more and more hospitals are moving to online. Sometimes they're adding it to the in-person support so that you have the monthly maybe get together, and then in between you have the opportunity to communicate online. Why though a Facebook support group? And the answer to that really is that's where your patients are already. And the hardest thing about starting a support group is getting people used to using a new platform and developing a habit to check in there regularly. But if they're already on Facebook and you open a Facebook group, then it's very simple for them to engage. You remove a lot of that barrier. Also, in the last year and a half, Facebook has made a serious effort to improve the features of groups. And it's made it much easier for community managers to manage a group with all these additional tools. So there are those really big advantages to Facebook support groups. Next slide. In the last while, Facebook's released a slew of new features for groups, and you can see some of those listed here that are part of these tools that make it easier to manage. And we'll be talking about some of these as we go on through the webinar. So in the next 25 minutes, we're going to talk about 3 different things. We're going to talk about how to start right, what you need to know before you even start a Facebook support group, how to grow and manage that group right once you get one going. And then third, we're going to talk about the ability to add ROI to your group. After that, we'll have some Q&A, as Taryn already mentioned. So let's talk about how do we start a group right. I think the first question you want to ask is, what's my problem? So in order for a Facebook group or support group to be successful, you need to be solving a problem, both for your hospital or clinic or organization and for your patients. And if you don't solve a problem for both, then it's not going to be successful. You're going to lose support over time, or you're going to have patients that are disinterested. So make sure from the very beginning that the idea solves a problem. One of the ways that you can evaluate that is, does the idea of a group align with my marketing objectives? So as a hospital, you've decided probably we want to grow the market in this service line or that service line. And if you already have that as a marketing objective and you can align a group with that objective, now you're growing this loyal core of supporters and people interested that are even more likely to become patients. So that's one of my things I advise clients all the time. Align your group with your marketing objectives. Then you want to make sure you have the internal support and the external interest. So the way you do that is you conduct some interviews. You go to the people in your organization who've got to make the decision to provide some support to your group, whether it's a person for an hour to a day, or whether it's some kind of budget to promote your group or whatever. You want to talk to those people. Here's what I want to do. Can you back me up on this? And this isn't just short term. You need a 1, 2, 3, 5-year mentality, and maybe a long time with a Facebook support group. You're not going to get the results you want in 3 to 6 months. It just takes longer than that. So make sure there's the support for it to last as long as you need, and to understand where resources are necessary for you to have success. On the other hand, you may have a great idea. Wow, our bariatric surgery patients, they'd love a Facebook support group. But how do you really know? You can assume that. But so I recommend that you take 5 to 10 to 15 potential members of your support group and interview them. We're thinking of starting a support group. We're going to do it on Facebook. Would you want to be a part of that? And if you were, what would that experience be like for you? How often would you check in? Would you ask, what kind of questions do you think might be helpful from the group that you might ask? Or how often would you want to help others who are going through the same thing you are? Do that interview, do that research with 5 or 10 or 15 to make sure that your idea actually does meet their needs. Next slide. The other thing that's surprising sometimes is you'll find that you're thinking, wow, we need a pancreatic cancer support group. We need to start one of those for our patients. And you talk to them and they go, oh, no, I'm already involved in one of those. So you want to identify your competition and go beyond just the patient interviews for that. Do the Google searches, search on Facebook for any other group like what you want, and then see what's the regional appeal. How many people belong to the group? How active is the community? And do that kind of research so that you're not creating a community that then you find out people say, oh no, well, I'm already involved. This would be the case with lots of new moms. New moms already have quite a network, and many of them have already joined groups in the community that have to do with newborns or even raising kids. And you might come up think, wow, it's great, we need that, we want to pull them into our organization. But wait a minute, maybe they're already invested somewhere else and it isn't going to be the value for them that you think. So make sure you do that competition. You do want to decide up front, is my group open, closed, or secret? So simply stated, open is open. Anybody can join. Anyone can see who belongs. Anyone can see the comments that take place and post in the community. The opposite is the secret group, and it is secret. The only people who know about that group are people you share the URL with, the link to. People can't find it in search. If they stumbled across it by somebody else's invitation, they can't see who's in it. They can't see what the comments are. And so that's the most closed you can possibly be. In the middle sort of is the closed group. And most Facebook help or support groups are closed. They select the closed option. It's nice in this way. People can find it. If you want to make it available to those who are searching, they can see who belongs to it and who sponsors it, but they can't see any of the comments or posts. So you have this more visibility, but still have the privacy. Those are your three options. You want to start from the beginning to know which way you want to go. Next slide, please. You want to pick the right name. So if it's a secret group, it doesn't matter. But if it's an open or a closed group, then we recommend that you select a name that reflects the illness or the challenge that your patients are having, whether it be support or new moms or cancer or whatever. Also give it a geographic location if you're trying to focus on those in your community. That's an appeal to people. And then the third thing that you want to have in your name is the organization. So who's sponsoring the group. So if you pick a name that incorporates those things, then that gives people a really good idea when they're searching if you're the right match for them. Next slide, please. Then you want to pick the right community manager. There's a lot we could say about this, but this is absolutely essential to the success of your community, that you have a community manager and that manager has the right mindset. We'll talk about that a little bit in a little bit. We can't go into all the details here that I would like to about selecting a community manager, but I've created a guide about the 5 mindsets that we need for successful community managers. If you're interested in getting that, then just put send me the guide in a comment on the side of the webinar, and I'll make sure that I get that out to you. But the right community manager is really essential. Once you've done those things, you've done your research, you know your idea is solid, you've got the internal support, you've identified the right name, picked the right type of group. Facebook makes your setup super easy. It's just a click, click, click through. And they'll even give you, next slide, please, should be on lots of prompts and tips. It also gives you an opportunity to actually be prompted as you go through. And one of the prompts is setting up rules, creating rules for your community with examples of them. They've made this like the most user-friendly you can possibly be. But the thing you want to be aware of that Facebook doesn't get into from the very beginning, next slide, is what about HIPAA? The question people ask me most about groups is, Dan, what about HIPAA? How do I make sure we do not violate HIPAA in these communities? And the answer really is, it's not that different from a Facebook page. You just need to make sure it's clear to people that they can't talk about other people's health. And the way you do that is by putting that information in the description section of your group. This is where you're going to put rules and disclosures. And for example, here, this hospital said to ensure that this group and discussion boards comply with privacy laws and to respect the privacy of everyone involved, please limit posts, stories, and discussions to your own experiences. So that's a nice way of saying beware of HIPAA violations. Talk about your own issues, not somebody else's. And so to the next slide with the pin welcome post on it. The other thing is, so that's in your description area, and you put the rules in there that you want to, and then you have the opportunity to pin a welcome post with these rules so that the first thing people see when they come into your community is, again, a warning about the proper rules. And it's more than just HIPAA. It's be polite and don't use profanity and be respectful and all those other things that you want to say in a way that helps people feel safe in the group. But the welcome post and the description areas help you to also avoid the HIPAA issues. And then, of course, to avoid HIPAA problems, you want to monitor your community regularly. And that's that 30 to 45 minutes a day. If you're in there and you're looking for and you find violations and your description is clear about the rules and you react responsibly just like you would on a page, then you're certainly going to be in the realm of acting properly in terms of HIPAA. Next slide. Okay, so now we've talked about the keys to starting a community. and you've set it up using the great prompts, and you've got the right description in, and you're ready to go. You've picked the right community manager. Now, how do you grow and manage your community the right way? Let's start by saying and pointing out that there's a very, very big difference. New slide, by the way. Keep forgetting to prompt Margaret. She's doing these for me. So there's a very, very big difference between managing a Facebook page and a Facebook group. So a Facebook page, even though we talk about Facebook building community, basically what we're doing is we're posting information, we're putting it out to people who belong to the page, we're boosting it maybe, and then we're reacting every now and then to somebody who might have a question or says something that isn't quite right? But a Facebook group is totally the opposite. You flip the whole mentality. It's not about putting information out. It's about bringing people together. It's about giving people who are distressed and worried and fearful and concerned and upset, but also maybe hopeful and optimistic, a safe place where they can share their feelings with others who know what they're going through. That's a group. And as I mentioned, it's very different than a page. Takes a different mentality, takes a different approach to management. Next slide. So the glue that binds a community, it isn't education. It isn't you telling everybody the latest information or providing links to articles or blog posts or whatever. Patients can get that in a million places. There are thousands of resources online. They come to the community for the emotional disclosure, the sharing with each other who are going through similar difficulties, who understand one another. That's what you're creating in the community. Next slide. So as a community manager, don't be a know-it-all. Don't be the first one to answer a question. Don't be the first person to correct somebody who has said something inappropriately. No, you've heard this a lot in social. Be a party host. Gather people together. Introduce them to each other. Help people meet other people who share concerns and worries and fears and hopes. You know, be that person who's helping people get to know each other in a safe environment. Next slide. Invite the right people to the group, and you know who they are because the first ones are going to be those potential group members that you interviewed in the research stage. You're going to ask them, will you be founding members of this group that we're starting? And play an important role there to make it successful. So you're going to invite the people that match, of course, the dynamic of your group. The most successful way to invite them is to just simply give them a personal invitation. We know you, you're a patient here. We want to have you come join a group, especially in closed groups. The other thing to keep in mind from the very beginning is always start small. You don't want to send out a mass invitation for 500 people to join your community on day one. You've invited these founding members. That's 10 people maybe. You invite 10 more, maybe 15 more, and you let that group interact for a week or 2 or 4 or 6 so that there's content, there's activity in the group already going for you. The point here is not numbers. Numbers isn't important in a group. The point is activity, interactions, disclosures between individuals. So once you get that going in these first 20, 30 people in your group, now you're going to invite more. Because when they come in, they'll see the activity is there. People are disclosing, they're sharing, they're seeing how the group functions. They want to be part of that. They see that what's happening there is useful to them. If they come without that, without the activity, they'll never come back. Your group's dead. They won't return and say, oh, maybe I'll check again next week and see if there's some activity. No, they're on to the next thing, right? So make sure you start small, develop activity there, then begin to grow. Facebook has provided some great tools. Oh, next slide, please. And then now we're on the slide that says in a closed group. So Facebook's provided a lot of tools to help people to manage communities. So for instance, in a closed group, you can screen new members by having them answer questions before you accept them. up to 3 questions right now. And those can be questions like why are you joining the group? Or who is your physician? If you want to make sure that you're only limiting your group to people who are in the program at your hospital, for example. Or what do you hope to learn from the group? Or those kinds of questions, anything like that that you want to ask, you can ask up to 3 questions. And then when you go to accept or reject people from the group, then you see how they answered. And then you know whether they're the right fit or not for the group. One thing, though, to be aware of is that once you accept them, those answers go away right now, unless Facebook changes that. And so what I recommend you do is actually create a kind of a spreadsheet. Collect those answers, pop them into a spreadsheet before you accept them. Now you know something about those people who are joining that can be helpful in your role as connecting members of the group with each other. Facebook also has this great welcome to the group function. Every week, they'll tell you, for example, you have 4 new members this week. Write a post to welcome them. This is super helpful because that helps them feel included in the community, but you can also use that as an opportunity to invite others to welcome. So these founding members or people that you see are particularly engaged, you might reach out to them, sometimes through a message instead, and say, would you welcome these 3 new people this week so that they feel like they're part of the community? So this can be a really useful tool for you. You can broadcast live video in groups. And so that's a great way to educate or inform or to share emotions or ideas. You can survey your members with polls. Yeah, next couple of slides, Margaret, where, so you see the poll function, that's another way to go. And then next slide, but be careful to keep the right mindset. So what I mean by this is don't get so wrapped up in things you can do to increase engagement in the community that you forget that your role is not to initiate everything. Your role is to encourage people to connect with each other. That's way more important than them seeing your latest post. So keep that in mind. Use these tools, but use them in the right way. Next slide. Group insights are just like the most amazing helpful thing that Facebook has added to groups in the last several months. Next slide. So within insights, you can see more about growth details. How many new members have joined in the last 28 days, for example? You set the times to different limits. How about engagement? Who's engaging and when are they? About your member details. It's all there in a lot of detail. So as you're managing your community, you can see, oh, most people are on here in the late afternoon. Maybe that's when I should check in. You know, oh, so-and-so has been posting the most in this last month. I ought to give her a direct message and say, thanks for your support. You know, I mean, there are lots of clues here in how to help your community feel welcomed and involved and connected through your group insights. Next slide. Of course, you want to monitor your community regularly, and we say initially about 30 to 45 minutes a day. You should plan on spending. Sometimes when you're monitoring, things are going to go sideways. So overwhelmingly, the people in these groups are polite and thoughtful and respectful and don't have problems in following guidelines or rules. But there are going to be those times when things go sideways. As a community manager, your job is to manage that. And for 2 reasons. One, you protect your organization that you belong to and their reputation. And secondly, your job is to continue to create a safe space for those members to come and not feel threatened or attacked or uncomfortable. And so the way you start, you kind of escalate this through a series, right? You start by warning a person. According to, as you know, our guidelines prohibit this activity. And this is a public warning. Post it right in the community so other members see that you're taking that action and other members feel that you're protecting them from this kind of behavior, right? And that we're enforcing these rules to the whole group. So that's the first step. Warn about it. For more times when people violate the rules, then you can go up the spectrum. You can hide the comment. You can delete it. You can turn off comments for the whole community for 24 hours or 48 hours or whatever you want. Things get heated, you put a post in there, look, we need some time to cool down, and you turn off the comments, and then 24 hours, 48 hours later, you bring it back and then see what the tone is in the group. If there's some serious issues, then you continue to deal with that by suspending or banning members. I mean, it's tough. It seems extreme at times, difficult to do perhaps, but it's your job as a community manager to make sure your organization is respected and is reflected in the right light, and that members are protected in a safe environment. Next slide. There are lots of resources about community management. 3 here that I really like. Fever Bee is all about helping community managers. cmxhub.com, same thing, a Facebook community for community managers. And then, of course, my agency, hivestrategies.com, we try to put good information there to help with this as well. So when you've got this community going well, then you're able to see a response similar to this community manager. She manages a liver transplant group for a major hospital. And she shared this with me. She said, for example, there was a time when a patient, a liver transplant patient, was freaking out because there was an adverse reaction happening, extremely serious. This is happening in the night when she's not monitoring the community. By the time she sees the post the next morning, there are 5 or 6 comments there already from others in the community who were able to weigh in and give her encouragement and support and compassion right as she's going through the difficult time. She got that help right there. This is the potential of a support group, and the value of all the work that it can take to set it up right and manage it right is that it changes people's lives, blesses them emotionally as they're going through these really tough, difficult times, and it also benefits your health system or hospital. And so we'll talk about that next slide. We'll talk about ROI now. And so when you're in that early stage of talking to stakeholders about support, you have an opportunity to discuss with them the fact that you're developing a community that is going to really be a benefit to the hospital in terms of revenues as well. So next slide. And why is that? You've developed tremendous loyalty. Think about how these people in this group, you've done the right research, you've invited the right people, you've got the right discussions going, they're providing the right support to each other. How do they feel about you? They love you. This is an awesome institution. This is a wonderful group of people. They have helped me so much. So they have this loyalty and this trust for you. So what are you going to do? You're going to listen to what they need. You're going to educate them about the services that you can offer to help with that. You don't sell. There's a total difference in the mentality, how people accept education and how they accept selling. And so you don't ever sell, you educate. You say, for people who need this, we have this opportunity. And so what services do the members of your Facebook group, support group, need? What do they need? You've been listening to them. You're managing this community. They're talking with each other about their needs. You identify those needs. You link it with services that your hospital provides, and then you talk to them about it in the community. And that's the way you generate ROI from your community. If you have the ability to track that within your system, all the better, because now you can say, this person who belongs to our group scheduled this surgery on this day, and we know that in some way the group has motivated that, or however you want to link those. But that's how you connect, and from the very beginning talk to your stakeholders. This is what we're going to do with this group, because you are going to have a devoted, loyal, trusting, core super user group that you can then help generate revenues from the hospital while you're helping them go through tough times. Next slide. So So we've talked about how we start right. We've talked about managing. We've talked about ROI. We started with the journey. So just for fun, the update on my wife, who through this 6 or 7 years, through exercise and diet, has been able to reverse her diabetes. I'm happy to say now her A1Cs are totally in a normal level. I'm thrilled that she was able to be successful at that. I'm still ticked at the hospital and the doctor, who were not helpful in this process. The difference it could have made for her with the community, to me, is night and day. And as one community member said, next slide. As one community member said, I do not have any family support, physical or emotional. At times, the isolation and the depression are too much to bear alone. And that's when I cry a few tears. It is receiving support from this group that is my lifeline. So here's what I'm asking you to do today. You know about these groups. I want you to be influencers in your organization. Not all of you are in a position to make a decision about should we start a group or not. Some of you are, some of you are not. And those of you who are not, you're going to be in meetings, marketing meetings, strategy meetings. You're going to be talking to service line managers, maybe. You're going to be having discussions. You're going to be having lunch with friends in your organization. Be an influencer. Raise awareness. Let people at your organization know that Facebook support groups or any kind of support group can be a tremendous benefit to patients and to the hospital. Do some good, both for your patients and for your hospital. Thank you so much for listening. And now I'm going to turn the time back to Taryn for questions.
Thank you so much, Dan. That was a great presentation with so many really powerful takeaways. We have we have a few questions, and Dan, there was a lot of interest in the community manager guide, and so you'll be able to share that with our members.
Yep. Anybody who says send me the guide in the comment box, I'll go ahead and send that out to you, and then I can also post it in the community later. Great.
Thank you. One of the questions is, are there HIPAA concerns with closed groups? Since you can see who is part of that group, does it interfere with members who are also patients?
That is a good question. There are literally hundreds and hundreds of support groups, Facebook support groups that hospitals and clinics have started. And so obviously the official reaction is check with legal to make sure that they don't have concerns about this. But we know that this is a common activity for hospitals. And even though people are able to see who belongs to the group, since they're not able to see any of the discussions or conversations in a closed group, then I think that's why legal departments are saying this is safe for us.
That makes sense. Thank you. We have another question from a viewer. What do you do when you need to wind down a Facebook group and your participants are still in need of the service?
Oh, wow. Of course, I would recommend not winding it down, but if people are still being served by it, but if you have to, then I would do my best at helping those people find another resource. I would feel obligated to do that, to check around and see where can I recommend these people go to get this emotional support that they've come to rely on us for. I would also make sure that you explain in a friendly, what's a better way to say than friendly? Explain in, that you have plans to wind the group down over a period of time. Make sure people understand why you're doing it. Full disclosure with the group. Make sure that you are compassionate and empathetic, of course, as you do that, which should be a given. Maybe they want to start their own group. I mean, you know, you can have this discussion actually in the community. This is really probably my best advice. You just post in the community, unfortunately, we'll be shutting this down in such and such a time. How can we best help you meet the needs that we've been meeting here as we discontinue? What are some of your ideas and thoughts and feelings about this? And so get the group feedback, and then along with that, I would say, try to find alternate resources for them. And then, of course, if you need to shut it down, and that's a decision that you're making for the best interest of your organization, then, of course, follow through on that.
Thank you, Dan. We actually have quite a few questions coming in. We'll do our best to get to all of them. The next question, can you please explain the importance of disclosure more?
Oh, yeah. So the way I try to explain that is that what you want to create in your group is the opportunity for people to talk, most of all, about their emotions. So someone's going to say, so I'm a bariatric surgical patient. I mean, you could talk about the technicalities. Oh, when is the next checkup? Or do you like the lap band surgery better than the other surgery? I mean, you could talk about those things, but those aren't really what's going to keep people from coming back. What you want them to say is, man, I've just had my surgery 2 weeks ago, and I do not get this new eating pattern. I'm throwing up after every meal. And it doesn't seem to make a difference what I do. You know, I just am really having a struggle. Who else has been through this? So they're going to talk about their fears, their worries, their concerns, their challenges, their real problems. That's what I mean by disclosure. So you want to generate discussions around that, because it is the emotional peer-to-peer support that really keeps people coming back. They can get information anywhere. It's knowing that they're talking to people who get what they're going through. So the more emotions that can be shared, the better for that to happen.
Sure. We have another question. In closed and secret groups, comments and conversations are cut and pasted on personal pages, thus are searchable. Is that a problem, or should the rules of the group cover that?
Right. So I assume this question says I might be taking information out of the group and putting it on my own personal page. Totally, there should be a rule that says this is just a giant no-no. And even to the point where you might say it's grounds for, you know, dismissal from the group. And what will happen is frequently group members connect with each other on Facebook anyway. They friend each other. And so you do find out sometimes, you've seen this happen, you know, in other ways too, through social, but you do get the word, oh, so-and-so's posting on her personal page, right? And so there, you do end up getting these clues that that's happening. And right, one of the important rules would be what happens in the community stays in the community. It should not go outside here in any public way visible.
Sure, thank you. If you're watching, thank you so much, and please do include your if you have any questions for Dan in the comment section to the right of this video. Dan, our next question: do you recommend having a physician? So this is in relation to education. Do you recommend having a physician at the hospital who treats patients with the disease or disorder host a Facebook presentation about new therapy, a new insight about the condition, etc.?
Yeah, I think that is a really good idea occasionally. So you wouldn't build your group around that kind of activity where, oh, we check in once a week to watch the Facebook Live from the professionals. You know, you want it to be around that emotional bond that they develop with each other. But so something like that every, say, 2 or 3 months, is really helpful. It positions, it's one of the ways you can create ROI from your organization is by introducing ideas, services in that kind of a way, but have it be irregular and have it meet a need that's being discussed in the community. Match that up, or else you're going to be careful that you don't come off as trying to sell a service As long as it meets a need and it's infrequent, and your focus is on emotional sharing, then I think it's an excellent idea.
Thanks, Dan. I have another question. How do you manage members who are trying to spread ideas that are not accepted by mainstream medicine?
Yeah, this is a really good question, isn't it? This becomes kind of an internal discussion, I think. Every group is going to manage this a little differently. And I recommend the way to measure that is by the harm that's done, right? So if you're in a group and it's a cancer support group, and somebody is saying, oh, garlic, is really my solution, I'm not doing anything else, then you wonder, is there harm being done by that advice? And if there is harm being done, then you're going to want to deal with that individual in the kind of ways we've talked about. You want to warn them. You want to have this in your guidelines, of course, up front. Please share within the group medically appropriate advice. Should be totally one of your guidelines. But what's medically appropriate advice? People can have different opinions about that, right? So I'd measured about harm done, and I'd measure it by the frequency of it in the group, and I'd measure it by the opinions of the physicians and others who are the stakeholders in your group. And everybody's going to set a little different bar based on the disease that you're dealing with, the frequency of that misinformation, and you just kind of have to navigate that and sort that out. But if there's a decision that harm's being done, then no fear about blocking those or educating people about how to deal differently. And your responses to that help the community learn to navigate that even better.
Thanks, Dan. That makes a lot of sense that you would set a threshold at harm being done, so that people can still feel free to share their opinions or talk about what is working for them openly. But like you mentioned, without really to the, either the annoyance or the detriment of the other group members. Another question that you did hit on a little bit, but maybe you could talk about this aspect a little bit more in detail. So to repeat a question that has been asked, by being a participant in a group, is it not implied that they are a patient, thus HIPAA concerns? So does their mere, so not necessarily the content that they post, but by their mere being a member of the page, does that imply that they're a patient?
If you set up your page as being limited only to patients, it could imply that. If your closed group, though, is open to anyone in the community who has a concern or interest in, wants to be a part of a group that deals with that, then you're not really indicating that they're patients of yours. And I guess, again, I know lots of closed groups that are limited to only their patients, and their legal departments are approving those. So I would say that that's, again, a question maybe for your legal team, but the general behavior out there in the support group world is that isn't violating HIPAA by the choices that they're making in terms of how they're setting these up.
Thank you. Another question for researchers, can you recommend guidelines for determining whether to start your own group versus accessing an existing group? When accessing an existing Facebook support group serving patients in your research area, do you have suggestions for messaging that is likely to gain Facebook members' participation in your research project?
I do not. I don't have anything that specific for you, but something I could certainly think about. Let me try to reply to that comment on the page in the next couple of days and see if I have some kind of suggestions or ideas there.
Sure, I think that's a great idea, and it really is a timely question. And I don't know if you are they're referring to clinical trials as well, But Dan, have you, in your experience with groups, have you seen researchers interested in posting about their clinical trials because they know you have an active group who is discussing a particular disease, and some of those members may be eligible for the trials?
Yeah, I'm totally seeing a lot more discussion about this and interest in this. So it is a growing area of interest, and for good cause, because you do have that self-selected group that you could reach out to there. So I think it's something that is ripe for even more exploration. I might mention too that one of the things I offer through Hive Strategies is a 1-hour consultation. I mean, if people have questions that seem to be more, I'm trying not to be overly promotional in today's webinar, but if people have questions that seem like they're more detailed or more complicated or would like to dig a little deeper, then you can go to my website and express an interest in a free consultation. I'm happy to get on the phone and go into a lot more detail on some of these questions.
Thank you, Dan. Any final comments from you before I go ahead and close the webinar?
Well, thank you, Taryn, for doing such a great job hosting today, and for Sean and Margaret for keeping us on track with all the tech and trying to follow my slide changes. Margaret, I really appreciate that. And I'm really grateful that you folks have gathered today to learn more about this. Like I think I've said, we can do some real good with these. We can help people through tough and difficult times. And I think it's an opportunity for us to advocate for and to help that happen. And that as we do, we'll really bless and change people's lives. So I'm really pleased that I have this chance today to share this information with you. Thank you for being part of this.
Yes, thank you, Dan, for the amazing presentation. Thank all of you who tuned in to watch for joining the webinar today. Within a few hours, this webinar will be saved in our social media network archive on this same page. So please feel free to share it with other members or with those in your organization. And just as a reminder, our next webinar is August 14th. So in less than 2 weeks, please mark your calendars. We are talking about how to turn authentic stories into social media sensations. That'll be with Jen Rittenhouse. It'll be a great presentation. So thank you for joining us, and we'll talk to you then.